the VCA Voice podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, we're chatting with Dr. Heidi Houchen about veterinary mentorship and veterinary internship. Glad you could join us. Dr. Houchen, thank you so much for joining us, and I will apologize in advance. I'm probably just going to revert to calling you Heidi during the course of the interview, so we're not quite so formal, if that's okay.
That's perfect. Thanks for having me.
I know you have lots of great input on mentorship and internships and have had a wonderful career yourself. So I'd like to start off with just helping our audience to learn a little bit more about you and your progression through veterinary medicine and how that came to be.
Oh, thanks. And I do appreciate being asked. This is, as you well know, as you go on your career, you have favorite parts of it. And this is one of my favorite parts to talk about is mentorship. Less so about myself, more about the mentorship. Going back to the beginning, in terms of how to become a veterinarian, when I first started, I'm going to quote a good friend and colleague of mine that for my gender and for my generation, with the love of horses, that equine medicine was kind of the gateway drug for veterinary medicine for a lot of women of my age, if you remember that. So I started out wanting to be a veterinarian, and my high school teachers were saying, sure, maybe, yeah, you're good in school, but that's a tough profession. It's like what oil riggers do. And so I turned to one of my first mentors, which was my father. He was a rancher, and he said, well, of course you can be a veterinarian. That's not an issue, but first do your chores, get your work done, work hard. So it's not about the roadblocks. It's about focusing on what you want to do, and which was really good advice. His mother had homesteaded as a Norwegian up in Montana, so he had no issue seeing a woman in one of those roles. So after my undergraduate degree, I worked in many different hospitals. I worked at racetracks and ER hospitals and large animal veterinary hospitals. And that's when I found out the secret that I was an adrenaline junkie. And I love the immediacy of ER and critical care, of being able to touch lives right there, right then, help out. And you never know what's going to walk in the door, and anything and everything will walk in the door. So I was really drawn to emergency medicine. And I've worked in 6 states and 9 hospitals. The last have been the best. I've been 17 years at VCA Northwest Vet Specialists, and I love it there. I love Oregon. I love where I landed. I'm one of those fortunate people that I don't work a day in my life because I love going to work. It's been a wonderful and a very fortunate situation.
Yeah, that's great. I completely share that. And, I want for other people, as I know you do, to experience the joy in veterinary medicine that I know I've been able to experience. And there's just so many wonderful, interesting things that can happen in our profession. Tell me a little bit about your roles within VCA and how you came to be at VCA Northwest after being in a number of different work situations.
So I joined VCA Northwest Vet Specialists a year or two before they became VCA. I had worked at another ER hospital where I'd been an intern director, and I came over to Northwest because it had such a depth and breadth of specialists. I really liked the team that was there. And VCA acquired them in 2008. And I had known about VCA quite a bit from many colleagues who had worked there. And I knew about their mission statement, and I especially knew about their internship program. So I was pretty excited when VCA acquired Northwest, because we had been thinking about an internship program, and VCA really encouraged, and myself and Dr. Rochelle Lowe created the internship program at Northwest. And it's been a fabulous experience. We have done so many things. We've had the opportunity to mentor, I think it's over 47 interns, and it's actually been one of the best parts of my career. I have done many things within the ER world and been an education director and been a blood bank director. Could also have a podcast about that. That's fabulous. Intern directing and mentoring is really what's nearest and dearest to my heart. The ability to interact with young doctors, it's been not only win-win, I think I've gotten the better end of it.
I'm really happy that you pointed out the VCA's reputation as being a strong trainer for interns. We are approaching the 3,000 mark of interns that have trained with VCA since our inception. And this is a part of our profession that I feel really strongly about, as I know you do. Tell me, what is it about being an intern director that is really rewarding, and some parts of that role that are really challenging?
Oh gosh, I was going to say, do you have hours and hours in terms of really rewarding? It is, it's one of those things that from being an intern director, from being, and I'll let you know, at VCA Northwest, we have mentoring at many levels. Certainly they have their individual mentor, they have the intern director. When the interns walk into the clinic, everyone kind of mentors them. So they get it from multiple aspects. For myself, in terms of it, it's the ability every day they keep me on my toes. One of the parts I like about emergency medicine is you have to keep learning every day. It keeps you curious. The same thing is every intern that comes to you is unique and special, and they bring their background. They bring the background that they come from each school, because each school has the ability, has their strengths and their weaknesses. And so you need to see each intern as unique individual, what they need in terms of to help them become a doctor at that point. The hardest part has never changed, and that's the definition of what mentorship and a clinical internship year is that year of translation. Is they have to take all that academic learning that's in their head, and they have to translate it out through their hands to clinical skills and out through their mouth to be able to communicate. So it's taking everything in their head and learning to translate it to another part of their body. And everybody does that a little bit differently. And that's both a huge, it's a wonderful thing to see, but it's also a big challenge because everyone's unique and different. So it's being able to meet the needs of each individual to help them become a doctor. It's also sometimes counterintuitive. We discussed this, their internship orientation week, is what got them to where they are isn't going to get them any further. Academic learning takes you so far. To become a doctor, you have to learn a whole new skill set. And they need to learn it's not about the grades or competition or anything anymore. It's all about the animal. It's all about helping the owner and the animal and that family. And if you can get them past that, all of them love that. It's like it's all about something else than them anymore. And they are all great about that. But it's taking that skill set for each person and translating it for the animal's sake.
Oh, yeah, absolutely. We hear a lot from industry influences that doing an internship isn't really necessary unless they want to become a specialist. Speak to me a little bit about that and some of the pathways of some of your interns over time.
So you just hit the biggest nerve that I have. I did an internship 30 years ago, ever since I did one. And I was one of only maybe 5 in my class of 60 who did one. And I think internship should be mandatory. One of the many reasons I love VCA internships is because of the different pillars of support in them. I think they should be well regulated and standardized. But if human medicine requires internships for one species and often even for one organ, I think for all the things we expect of veterinarians to do, I think internships should be mandatory. And I'm not taking anything away from academia. You have to remember, I have so many friends in academia that of the veterinary schools, when I started out, they were between 60 to 80% supported by state and federal funding. And now for some schools, it's either flat or less than 6%. So they're trying to do more with less. And with all the stuff that we expect them, I think we need to have that translational year to give them all the things that the school can't possibly do in 4 years. It's so much to ask. They need the clinical acumen. They need the ability to sit with somebody who's done that and see through the looking glass what that practitioner does. There's so many things that an internship year does. Some come in confirmed, like me, I was a dyed-in-the-wool ER, going to do ER. This is all I'm going to do. But there are many people who come in and they're not quite sure. And that's so important for them to see, because a day in the life of a private practitioner at a private practice is so different than a day in the life in academia. And both are valuable, but many people coming out, if you're going to be a specialist, are going to work in private practice. And you need to see it to know if you want to be it. You really have to see the day-to-day. So that's essential. They need to get the mentorship that they can get from private practitioners. They need the time to translate those skills. there are so many fabulous colleagues out there who are working in primary care practices and specialty hospitals. But to take somebody from the day they graduate and put them in there, they are trying to meet the needs of those animals and those patients. And teaching isn't necessarily forefront because they've got so, especially now after the pandemic, they've got so much to do. We can't expect all those people to train and do that. They don't do it in human medicine. We shouldn't expect it to do it now. So sorry, I could go on and on. It's a very big deal to me. I think it's super important to do an internship. I think it's incredibly valuable for so many perspectives. My interns have gone on to become doctors in so many areas. It's almost completely split, a third, a third, a third. A third of them have gone on to specialties, imaging, clinical pathology, medicine, surgery, all those. A third have gone on to become primary care practitioners from North Carolina, Florida, Minnesota, Oregon. And then a third, near and dear to my heart, have become emergency veterinarians. Several have stayed with us, but they've stayed in my little world. So they've gone on to do everything.
I also feel strongly about, I think with the early career veterinarians, when students are graduating from vet school, there's so many great options to go into now. And there's a number of strong mentorship programs that are not internships. And I also think about those students that are going that route, and what if a year or two into their career, they start to wonder, is there something else out there for me? Have you trained early career veterinarians who have been out in practice and have come back into internship? Do we welcome those individuals as well as brand new graduates? And what are the pluses and minuses that they bring to a program?
Oh, absolutely. I think we're very welcoming. Especially, as you well know, once you're in the VCA family, you're always in the VCA family.
Yep.
We are, and it's wonderful. I love hearing back from them in terms of, no, we're absolutely welcoming. We've had a VCA intern that came from, I personally, at giving an example, at Northwest, we had a VCA intern that came from Southern California. A friend of mine sent him up and said, hey, he wants to live in Oregon, wants to do ER, but I'm thinking there might be something else on his back burner. And he was with us for 4 to 5 years. And he said, I really love clinical pathology. And I said, hey, I have a mentor back at Washington State, my mentor in clinical pathology, Dr. Jane Wardrop, who taught me transfusion medicine. And I picked his phone and talked with Jane. I said, I think that he would really love to go on and become a clinical pathologist. And she took him up there, and it's been a wonderful experience. We love it. This is a huge win-win for us in terms of things, because we love shepherding people through different parts of their career. Mm-hmm. It's wonderful to see them. You should have a chance anytime during your career. This is another thing I have a tendency to tell the interns their first week is careers are never straight lines. They're never straight ladders. Anything in social media society that tells you go from point A to point B with no mistakes and it's a perfect line is wrong. All the fun and all the learning and all the things that make you, or all the side trips, are all the journeys, all part of the pathways. Enjoy them, because they will bring all those special attributes to your final decision when you get there. All the things that make you, like, he's a better clinical pathologist because he's an ER doctor. He can speak to those people on the phone so much better. And I have another one too, who's also up there doing clinical pathology from last year. So it's fun to see the progression, help them at every phase. I think that's one of the things we enjoy doing at VCA.
I love that internships are a focus not just for people going into specialty, but to become a great GP doctor or an amazing ER doctor, or to join one of the diagnostic specialties. That's just wonderful. I am going to shift gears just a little bit. Tell me how you've been involved with the Oregon VMA and what that's looked like, and how did that all happen?
It was one of those things that I have had friends through the years. We've watched each other grow in our professions and our different clinics. And as you know, one of the biggest support in our lives, especially through the pandemic, is colleagues. Colleagues are everything. It's one of the biggest benefits to being this profession is finding people who might have differing personalities, but have a lot of core values that are similar. And I've had friends who said, we've seen you and you've run programs, you've done this or that, and you really need to put your money where your mouth is when it comes to women in leadership, and we need you to do this. And I kind of chuckled and I said, okay, this is this time. And it's actually one of the things when I give presentations and I talk to women in the profession is do things before you think you're ready, because you have the skill set. You may not have think you've dotted your I's or crossed your T's, but one of the hard lessons I've learned over life is perfectionism is the death knell for getting things done.
Mm-hmm.
Perfect is boring. You need to just push yourself. You actually have the skill set, do it. And so it's been a fabulous learning experience to be involved in the kind of political side of it and learning how to push things forward, how to help people in other parts of the state. Get connected with my large animal roots has been fantastic. Dealing with the wildfire issue and how to be prepared for the
Oh,
next
wow.
disaster has been great. One of the other things you do is you also get to learn, you get to shepherd some pet projects. And mine was when I came through as president, one of the bills was working dogs in the very rural part of the state for police officers as were injured, couldn't be transported in ambulances. So we were able to work
Wow.
with all bipartisan, all part of it to get it okayed that as long as it wasn't necessary for a human at the time to get those police dogs transported. And that led into, well, what about doing can anybody treat them? And so now my pet project I'm still involved with is I go around the state from south to north and I
Mm-hmm.
give first aid and CPR classes to SWAT teams and EMTs and police officers for their working dogs so that they can also support their dogs while they're on their ambulances. So I got to take my ER part of it, make it part of the political landscape. So, so put your money where your mouth is kind of the code there.
Well, I love that tie-in with your ER work. Having discovered your passion in ER, you also demonstrate, even once you get there, there's so many different things to do and to continue to grow. I believe that making sure that all of us continue to grow through our profession is one of the best ways to prevent burnout, becoming a veterinarian. And it's a serious issue we're dealing with. And I love that you point out being open to doing new things. Do you mentor younger like students, and what ages, and pre-vet, or is your mentorship in the Oregon VMA mainly focused on women that are already in veterinary medicine?
That's been a delightful part of it. So as I have gone through my career, besides having mentors in the profession, I also look for them outside the profession. You'll find that one of my favorite things is words and quotes, especially of people I admire. And one of the people, Ruth Bader Ginsburg, said, "You can have it all, you just can't have it all at the same time." And so I
Mm-hmm.
try to tell a lot of the people I go out and chat with that one of the nice things as I was on the floor straight for 25 years, and I kind of segued off and did more blood banking, more teaching, more mentoring and directing. Is it's wonderful to see that you can do different things with your profession and your career. So I've gotten to talk to everybody from junior high to high school. Women as well as men. It does focus a lot on getting women into STEM. So I've done a lot of STEM lectures and presentations to encourage them and show them, because they don't often see that they can make the leap to that. And so I want to really encourage them to do that. So that's been a part when I've been through the OVMA, is to talk to high schools, talk to middle schools. I did a couple this past spring, and it's great. And I find that the moms often will, because they'll come with their daughters, often ask questions at the same time. And I want to encourage them that they also should, consider the profession, consider going into science-based professions. But no, the mentoring has been all the way, all the different age groups up. The younger you can hook them, especially in science and in STEM, then the more we can get into the profession. And I've also talked to a lot of high schools and middle schools about, because I was a veterinary technician before I was a
Oh,
veterinarian, and
wow.
the importance of
Mm-hmm.
veterinary support staff. Right now, as you know, that's we have a lot of issues, as many professions do, and one of ours is getting enough veterinary support staff, and to encourage people to go in the profession, and to recognize how important our staff is so essential to us, to get them encouraged in veterinary technical support staff too.
No, and I'm glad you brought that up, because that's the support staff also plays a big role in mentoring and training new veterinarians and interns in the program. Almost, I think, more sometimes than the veterinarians do.
Oh, absolutely. I was going to say our mentoring is we have an assigned mentor. The interns get to choose their own mentor. 2 or 3 months into it, they find somebody they bond with, but they get mentored when they go through each of their specialties and rotations. They're the only one on with the specialist, and so the specialist takes a very one-on-one linear relationship with them, and then they're mentored by their intern directors. But also the technical support staff is very familial and often very protective of our interns. Like the first week or so, they're kind of eyeing them, and after that, they're very a situation like, have you had lunch? Have you done this? You don't look like you got a good night's sleep. It's adorable, and it's very sweet. And at the end of the year, we call it our Aloha party, hello goodbye party for the old and new interns. And it is a teary affair because we get very attached. And I have to say, one of my favorite things in life is I'll get texts. I got a text last night, an email or a phone call from former interns telling me where they are, what they're doing. Sometimes it's a blood question or a poison question, which I love. And it's like having a warm blanket put over your shoulder. It's a mood lifter. And it's one of the best, as you well know, it's one of the best parts of the job.
So that makes it sound like mentorship doesn't stop when they leave their internship and are out into the world, that these are lifelong relationships. Is that how would you answer that?
Yes. And I have that actually because of one of my mentors. One of my earliest mentors was Dr. Rebecca Kirby, who was one of the original founders of ER Critical Care. She started the ER residency program. Like, it seemed very intimidating, but she was all about paying it forward. And from the first week I started and I walked into one of the first ER internships that there were in private practice, she looked at me and she goes, I will always know where you go. I will always know what you do. And I will always have an eye on you. And you kind of think but it's wonderfully supportive, and it's wonderfully you were always a part of that group. You're always part of the family. So yes, it's a lifelong relationship. The text I got last night is, as you were saying, subparts and subspecialties of your profession, certain parts of it. And I love toxins and I love poisons, and my intern from back east sent me a picture. He was doing a radish and he made it look like the poisonous mushroom. He goes, now all these is a stem, because he knows, this is a time of year we get the poisonous mushrooms out here. And so it never, whether it's fun or it's a question, it never ends.
Oh, that's amazing that to have had that relationship with your mentor and be able to focus on those few key people that really help us to grow as professionals. So tell me a little bit about mentoring the mentor. How and being an intern director, certainly it's wonderful, and it also is very involved and can be stressful. How do intern directors and mentors gain support
from others? And I have to say, this was never more evident, and I hope I didn't take it for granted. But during the pandemic, there were days because it was pretty tough, and I felt personally responsible. My husband at one point had to say, I felt so bad for the interns going through the pandemic. I didn't see the other end yet and how great they were when they came out. But he's like, you didn't start the pandemic. Stop feeling guilty about it. And I'm like, I just feel so bad for everything hitting them. And I am from, as you know, Montana, so it's a suck it up buttercup kind of thing. And I just couldn't do that anymore in the middle of the pandemic. So I picked up the phone a lot and I talked to my fellow intern directors, especially in Chicago and back east in California. And I said, God, it's a rough day. And then they turned around and did it to me too, because we all like to think of ourselves as little islands and we're tough and we run programs, but really it's hugely interconnected. And the biggest strength you have is the fact that it's many, many people all going through the same thing. So there'd be days I just, can I push my body through space today? Can I defy gravity? And I'm like, grab the phone, go into work. And I would go in and I would see people, and it just was the best part were my colleagues at work and my colleagues on the phone. And just hearing their stories, they're like, yeah, I was in PPE. I looked like somebody, at Intel, like coming out to talk to this little lady who was a little worried about me coming out to get her little dog. So so the humor of it and sharing it with other people those are my mentors. They've been my rock and my support.
That's great. Of the 34, I think 34 rotating intern programs we have within VCA, that camaraderie among the intern directors and the support, it's even when we got together last April, finally for an in-person meeting, that being able to see everybody and feel the commitment that everyone has to training in that room. And it was really, really heartwarming to see that.
That was the best part of the pandemic, was seeing the commitment in the middle of it and watching all my peers and all my colleagues out in the parking lot, talking to the owners, reassuring them, spending extra hours.
Yep. And you're demonstrating to the people that you're training that client-patient relationship. And I love your point earlier of not focusing on yourself anymore and your grades and the competition, but focusing on outward on our profession and how do we learn and grow from that. I love that everybody loves to talk about millennials and Gen Y and all of the different groups coming along. What have you seen changes in interns coming in for training, or do you suspect that we were probably in a similar place when we graduated and went out into our first jobs and training? What things have changed and what things are really the same?
So you're right. I think we're all in the same place. I go back to, I'm trying to think, of course, it eludes me right now. There's a quote and it says, "Oh, the youth, they're bringing us down." It was like from Aristotle. So, I mean, ever since that time, people have like bagging on the youth. I'm also in a special place because I have a 24 and a 21-year-old at home. So I get to see it from all sorts of angles at the age group. And I think that they, of course, are in a similar place. I think they also have special issues. Like, we did not have a pandemic. Of course, we had our own issues, whether it's Watergate, we had our own recessions, we had our own sorts of things, but they are dealing with their own issues. And it's important to recognize that everybody has their own stressors, that same thing. I think now in terms of things, because the veterinary schools, as I mentioned before, they have to treat the students more like consumers. And when I've gone to talk to different veterinary schools and professors there, that they are encouraged not to be as negative. They're encouraged not to say anything directive or bad. And what happens, I think, is we are not giving the youth and the students and the young doctors the credit they deserve, because I can tell you almost to a person that the people that come out, my interns, say, the first thing I want is an evaluation and feedback. The first thing I want to know is how I'm doing, because I've gotten this knowledge, but I haven't really felt like anybody's given me anything because it's been deemed negative. And so that is the one thing that I'm seeing that's different, is I don't think we give many of them the credit that they deserve. They not only want it, they seek it out. They want to know, where am I? What can I do better? Where am I? What can I do better? So that's the one thing I'd say is that we, and we have the luxury, like, we don't have to tippy toe around that. We can say, hey, this part was good, this part is good, but next time I'd add this medication. When you're looking at a block cat, this is great. Don't forget to look at your potassium, that sort of thing. They are hungry for it because they haven't been able to have it, and they love the practical part of it. So I think we shouldn't hesitate to see that they're able to meet the challenge. I mean, certainly not bag on them or negative. I'm just saying, give them the opportunity to give them feedback. They will run with it. That's my thought process.
We're coming to about the end of our time. I just have a couple more questions for you. Tell me any words of wisdom you have for someone just entering the profession, and then also someone who is mid-career or has been a veterinarian for a while. What words of advice would you give them?
A little bit is what we had kind of chatted about before, is everybody wants to make the perfect next move, the perfect job opportunity. Should I take this job or that job? And look at everything that you have on the table. Look at what your decision is, make the best decision, and know that it's going to be okay, is what I'd have to say from myself, from my career, talking about you and your career, from pretty much everybody I know who's gone through it, is the journey is part of the process. Enjoy every part of it. You will take and learn, whether it's things you want to do or things you don't want to do later. You will learn from every part of it. Do not worry about being perfect. Again, a person I truly admire was Madeleine Albright, and she had a quote that said, there is a special place in, I'll say the word Hades. There's a special place in Hades for women who don't help other women. I extrapolate that to people who don't help other people. And I think it's essential to pay it back and to pay it forward. That's actually what you're going to get. That's the secret to life, is you get more out of it. I just think that mentorship is the foundational part of learning of veterinary medicine, of an internship program. It's how we keep vets engaged. It's how we keep them in the profession. It's how we get that foundational knowledge and good habits for our interns. It's just a metaphysical good for life is mentoring.
Oh, I love that so much. Heidi, thank you so much for your time and for talking with us today. I can tell you're really passionate about mentorship, and I completely agree with you that it really is the key piece to making sure that we're all engaged in our profession and able to give of ourselves to others coming up, as well as our clients and patients. So thank you so much.
Oh, I appreciate talking about this topic. Thank you.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Twitter, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.